Injuries to the carotid artery in the neck often happen from military combat, trauma, and even on the ice during a recent hockey game.
Seconds are precious, and stopping the bleed is extremely difficult because a traditional tourniquet can't be placed around the neck. However, a new life-saving device created at one university in our state is months away from possible FDA approval and nationwide distribution.
Spectrum News 1 reporter Elise Underwood shows us how the ARC project works and why it's so unique.
But then you would apply pressure on that to get it down quickly.
This is the arterial restrictive clamp, or ARC device.
This device, 100% occlusion in 10 seconds.
Saving lives in seconds is the motto. Dr. Tim Norman is a mechanical and biomedical engineering professor at Cedarville University and has been helping a group of students make the ARC a reality.
Then once they have this on, the patient is still getting oxygen to their brain from the other side. They're still able to breathe through their airway because that's open. And then it's just a matter of how quickly can you get this patient to help.
It started in 2018 with Lauren Edmonson's capstone project. She was an EMT with the local fire department and noticed a void when it came to treating this type of injury.
When I first was learning about carotid artery injuries in my EMT class, we were posed with a scenario of a car accident where an EMT had to manually control carotid artery flow that had been lacerated or cut. And so for me, that was nerve-wracking just because I knew if I had one patient with a carotid artery injury and then several other patients, I would have to pick and choose which patient I would be able to treat.
Under Dr. Norman's guidance, 4 engineering students came on board, and the rest is history.
The medics in the military carry a backpack, and you really want to have devices that are lightweight and perform more than one function so that they can keep their backs light and small.
Along with being able to clamp down to stop the bleed, the device actually has some additional features. It can pop apart, offering 2 extra ways to help save a life.
Bleeding in the femoral artery with straps.
The first is to help offer compression to injured parts of the body, but the second...
In this form here, we can take it, a little light right there, turns on with a switch, and we can use it as a laryngoscope for intubation.
For Dr. Norman, it's a good feeling to see students' work and visions pay off.
When this gets out and people are using it and saving lives, they really feel like that's a complete picture of what they were doing in their career, was creating things that then can be used in society for the greater good. I think that's they'll feel really good about that.
It was kind of a very, very novel idea in the medical community, something that was thought of as far-fetched. And so now to have it in our hands and be able to use it on models and show through different experiments that it's actually very feasible and that it works well is just absolutely phenomenal.
A product for the greater good, starting in the classroom. Elise Underwood, Spectrum News.
All right, now the team is hoping for full FDA approval by May. Edmonson graduated from Cedarville in 2019 with her bachelor's in science and allied health.
Now she's on her way to graduating from medical school this year.